Have you ever heard of an Ilizarov? Has anyone ever told you that you have to put on an Ilizarov, those cages, external fixator? Have you ever seen what that's like? Today I want to talk to you about alternatives to this type of treatment. My name is Mário Soares. I'm an orthopedist and I specialize in orthopedic infection. So first of all, I want to say the following. The idea here is not to badmouth Ilizarov, quite the opposite. Ilizarov is a method, it's a wonderful type of surgery, it solves everything. When nothing else works, Ilizarov solves it. It has another capacity, which is to lengthen and grow bone. So where bone is lacking, as incredible as it may seem, Ilizarov created a method, which is a Russian doctor, now deceased, but he created a method that practically tricks nature and makes the bone grow. So he has a wonderful indication for this. However, Ilizarov, for those who know or have seen it, is a very painful method. You have that external fixator, those irons sticking out, pins for periods of up to 2 years. It causes pain. Every patient with Ilizarov has pain. There are problems placing the pins. You have to keep tightening the screws. And this whole process is very painful. When I propose an infection treatment for a patient, I always think about what I would do to myself. If I could operate on myself in a situation like this, what would I do to myself? I understand that there are situations in which there really is nothing else to do but Ilizarov, but there are many others in which something can be done before Ilizarov. There are alternatives and solutions to using Ilizarov. And one of the things I preach, that I've studied, and that I think is worthwhile, we've treated a lot of patients like this, is the Masquelet technique. It's a very good technique. You can use fixation, in other words, stabilization of the bone, under the skin. You don't need to stick out any irons. You can even use a fixator to do the Masquelet technique, but it allows you to do it with rods, with plates, inside the skin without suffering. So you can go out on the street, you don't have to wear different pants or just shorts because of your Ilizarov. What does this technique consist of? This technique is very interesting. First of all, you have to debride the bone. You have to remove all the bone that is compromised, that is dead, that has osteomyelitis, and then you stabilize the segment you are going to treat either with a plate or a rod. Then you place a cement with antibiotics, which we've talked about in other videos here, occupying the space. And do plastic surgery to repair the skin, which is very important, both the skin and the soft tissue. If everything goes well, we'll monitor the patient with blood tests and clinical examinations. 5 weeks after this first surgery, almost miraculously, nature is wise on this point, a membrane is created around the cement that we put in, called a Masquelet membrane. It's like a periosteum, which is the membrane that covers the bone, only turbocharged. That we carefully open that membrane, remove the cement from inside and put the patient's own bone into the space left by the membrane. Then if it's a small amount, you can take it from the hip bone, which is the classic. Or there is also an alternative for larger volumes, which we do quite often, which is to take the graft from inside the person's femur canal, that marrow, which we know from the bone, we take it from the thigh bone, from the femur, and then we get a large amount to fill the defect, so we can get defects of up to 25 centimeters. In the literature, scientific studies have already shown cases with excellent results with 25 centimeters, which is very large. So in this second moment, you do the graft, close the membrane well, do the plastic surgery again, and wait for it to consolidate. The time it takes to resolve a surgery like this is infinitely quicker than if you use Ilizarov. There's much less pain, much less stigma about having the fixator sticking out. There are people who are psychologically shaken by having all those irons sticking out, tightening, making painful adjustments. Remembering here, we're not going to make the bone grow from a bone that already exists. We're going to leave that space in the position we want. Then we're going to place the graft. The graft is going to consolidate with the patient's bone. So it's a sensational alternative for treatment that used to only be done with Ilizarov. It's what I'd like to see done on me. It's what I preach. It's what I advocate. It's what I've studied. It's what I specialize in. Of course, there will be some cases where I'll recommend Ilizarov, but whenever I can, I'll recommend the Masquelet technique with internal fixation. Once again, thank you for being here on the channel, for following along. Like it, share it. My name is Mário Soares. I specialize in orthopedic infection.